The Food and Drug Administration is considering making changes to a decades-old policy that prohibits gay and bisexual men from donating blood.
News Channel 5's Jennifer Reyes has been following this story for us all day. She is in the newsroom with the very latest. Jennifer.
You know, Rory, you can really make a difference in your community by donating blood, and a lot of people do, but if you're a gay man living in the U.S., that's just simply not a possibility. For the last 31 years, gay and bisexual men have been prohibited from donating blood. It's a policy that was put in place by the FDA back in 1983 at the height of the HIV/AIDS epidemic. But times have changed, medical advances have been made, and gay activists say it's time to lift the ban.
A lot of people are amazed that it's still in place. I see discussions on Facebook, and I see younger gay men reacting, saying, I had no idea.
An FDA panel is now looking at the old policy, and many hope they will be making changes. One of the options being considered is allowing men to donate blood only if they haven't had sex with another man for 12 months. That proposal is backed by the American Red Cross, who released a statement last month. It reads in part, "We believe the current FDA indefinite blood donation deferral for a man who has had sex with another man since 1977 is medically and scientifically unwarranted." Dr. Louis Katz is the chief medical officer of America's Blood Centers. He says new tests can detect the HIV virus within 9 days of exposure.
So our donor screening approach and our ability to control units with abnormal test results is orders of magnitude better than it was then.
The proposed new guidelines could add about 317,000 pints a year to the U.S. blood supply. Chris Sanders of the Tennessee Equality Project says he has never been able to donate blood and hopes that the FDA makes that possible for him and the millions of gay Americans waiting to make a difference in someone's life.
If there is an entire population of people who can't donate, and those reasons are not based purely in rationality and science, then there's a problem. That's discrimination.
This isn't an issue that only affects us here in the U.S., gay men here in the U.S. Other countries have already started making changes to their policies. For example, Australia and Japan have a 1-year waiting period, and Canada has a 5-year waiting period. If the FDA does make changes to the current policy, it'll be a year before we see gay men donating blood. Reporting live in the newsroom, I'm Jennifer Reyes, News Channel 5 HD.